You can tell that I'm from England because I'm the only doctor in this entire building wearing a tie. It's a real pleasure to be here. I think we have so much to learn from each other internationally. General practice and family medicine is such a vitally important part of healthcare. And it's wonderful when we can meet together and share ideas. I love this idea of Denmark and the Netherlands and the UK having some sort of competition as to who can be the best.
I guess the chief advantages of the QOF have been that it has improved the quality of clinical care. The outcomes for patients with high blood pressure, high cholesterol, diabetes have certainly improved. There's some evidence that admissions to hospital with heart disease have fallen since the QOF. So it does seem to have had an effect on the things that you can measure. Where it's been a problem is in the things you can't measure. Many of our patients have complex problems that are very difficult to put simple measurements on, and some doctors are worried about that.
When the original concept was brought in, the government predicted that the average practice would score 700 points and budgeted accordingly. And we know what GPs are like. Give us a target and we'll hit it. And so the vast majority of practices got maximum points, which completely threw the government. The budget was completely thrown. And as a result, we've had a pay freeze now for about 5 years, as they're sort of waiting for our income to sort of, they don't think we deserve as much as we managed to negotiate.
Well, like GPs everywhere in the world, they see new introductions like this as a challenge and as an opportunity. I think a lot of people worried about it. They worried that it would change the way they practiced medicine. But at the same time, they made sure that they scored all the points that they could, that they got all the quality delivered that they could. In fact, their incomes went up, but very significantly. GP incomes went up by nearly a quarter when the QOF came in, because we did much better than the government expected us to. But people still worry about it, still worry that it's affected the way they interact with their patients. One of the biggest problems is that because doctors' pay depends so much on measuring things, on measuring blood pressure or asthma control or whatever, that too much of the consultation gets taken up with doing the things the doctor wants to do rather than the things the patient wants. So the patient comes in worried or frightened or whatever and finds their doctor measuring things, and then there's a bit of time left to deal with the patient.
One of the difficulties we've got is in the consultation now, the doctor has an agenda, which is to score as many points as they can. And the patient has an agenda, which is to get the doctor to take some notice of them and to listen to whatever their problem is. And you often hear of people going in to see doctors in the UK now with headache or backache or whatever. Before they can do anything, they've had their blood pressure taken, they've had their urine taken, they've had their cholesterol measured, they've had this done, that done. And then almost the time has gone before they can say, the doctor says, now what can I do for you? I mean, it's a slight exaggeration, but there is a real difficulty there.
If you're going to introduce something like the QOF in any other country, the chief thing is the government needs to work with general practitioners, understanding what GPs really do, the importance of being trusted, the importance of relationships with patients, as well as the importance of biomedical care. So it's got to be partnership, it mustn't be imposed.